We are in the throes of a global nursing crisis. And this nursing crisis affects millions of nurses, but even more importantly, it is affecting millions and millions of patients. And it is compromising their safety, the quality of care, and even their healthcare outcomes. So, this nursing crisis, you may have heard in the headlines, is about burnout. Well, my name is Dr. Lori Laws. I am a nurse scientist and trauma burnout expert, and this got my curiosity. I did 5 years of research across 4 disciplines, only to discover that there is so much more to the nurse burnout narrative than meets the eye. Oftentimes, if not most of the time, we have nurse-specific traumatization, which is a form of PTSD or post-traumatic stress disorder that is oftentimes secondary to the broken healthcare system. Now, all of this is affecting nurses and patients alike. And after I learned about how profoundly my colleagues were being affected, we have nurses leaving the profession in droves, in unprecedented numbers. By the end of this decade, the world is going to have just over half the nurses that it needs. And those who remain are being stretched to and beyond their capacity. So when you look at the headlines and you start reading about nurse burnout, it really is more than just that. That's just the tip of the iceberg. So what I am doing to do my part, to be a part of the solution, is I founded the Haelan Academy. Now, Haelan is the Old English word for healing. So this is a healing academy for nurses. And as part of my research, I wrote the book that you see behind me, which is a recovery guide that offers a 5-step evidence-based framework to guide nurses in their healing and recovery, while also teaching them how to insulate themselves from the broken healthcare system and the toxic workplaces in which millions of nurses are working. And what I need to ask for you today is I need to ask for your help. The Haelan Academy is a nonprofit organization, 501c3, that offers educational and recovery services to nurses worldwide. And it is our mission to be able to offer these recovery services to anyone who might need them. But we need your help. Up until now, this has been a grassroots funded effort. And by grassroots, I mean me personally, my resources, my time. All of this was done independently and self-funded because I wanted to make sure that I brought unbiased resources and evidence into the living room of nurses worldwide. As a nurse scientist, I routinely publish in peer-reviewed journals and present to national nursing associations. But I'm finding that the vast majority of the nurses that need this type of recovery and this type of support in their healing aren't at these conferences. They aren't able to read peer-reviewed journals because they don't have access to them. So this is my way of stepping up in my nurse leadership and working on behalf of the profession, and also working on behalf of all the patients and families who are similarly being traumatized by a broken healthcare system. I myself have had an adverse event that was near death. I had a near-death experience in a hospital, and it's more common than you might think. And so what the evidence has shown us is that if nurses are safe and healthy and well in their professional role, that is a direct factor to improving patient safety. Nurses being safe and well in their roles is a direct factor that contributes to increased quality of care. Nurses being safe in their roles and healthy and well in their roles contributes directly to improve patient outcomes. So when we help the nurses help themselves, And when we start looking at how it's not just burnout and nurses just need to take better care of themselves, when we find out that we have millions of nurses who have a very specific form of PTSD called nurse-specific traumatization, well, there's something we need to take action immediately. And that's what I'm doing. So what you might not be aware of is 83% of the nurses across the globe report burnout. You may also not be aware that 91% of nurses have one or more PTSD symptom. And alarmingly, almost 1 in 4 nurses meets the diagnostic criteria for PTSD. So I am asking you on behalf of my healer's heart, on behalf of my profession, and on behalf of the Haelan Academy, a nonprofit organization that is facilitating healing for nurses worldwide, we are asking for your help. And your help can come in the form of a donation. It's very expensive to bring a program of this caliber, of the highest evidence, and bring it right into the living room of the nurses who are suffering the most. So if you have ever known a nurse, have ever had an encounter with a nurse, or want to see how we can transform healthcare by starting on the inside with the people who work in the system and have that ripple out into improved patient safety, quality of care, and patient outcomes, please click the donate button and give as generously as you can, as regularly as you can. The proceeds that you donate go to bringing this program out on a global level. And as it gets going, we will also donate scholarships to nursing students and early career nurses. For what the evidence is showing us right now is that 1 out of every 4 new graduate nurse is leaving the profession within the first year. So for every 100 nurses that as a nurse educator that we put out into their roles, 25% of them say, no, I'm not working in these conditions. I will not. Now, you might be wondering how I might be qualified to lead such an effort. And so just a tiny bit about me so you feel very comfortable about making that donation is that I do hold a PhD in nursing. I completed 2 postdoctorate fellowships in integrative nurse coaching and integrative health. I have been teaching at an R1 university here in the United States in entry to practice program, a Bachelor of Nursing program. And I have completed the Equality Matters training, which is the highest standard for online education. So not only do I bring my expertise in the form of being a nurse scholar and scientist, but I also am a very highly skilled online educator whose course evaluations are among the highest in the university. So I want you to know that any donation that you choose to make will be treated with the utmost of respect and will go as much as possible to benefiting the nurses who need it the most. So again, please click the button below. If you'd like to learn more about my work, please visit my website at drlorilaws.com and we'll link that to you as well. Thank you so much for your time. Thank you for considering a donation. And if you've already decided you're going to make one, thank you so much. You have my word that your donation will go to good use in facilitating healing for the nurses who need it the most. From my healer's heart to yours, thank you and goodbye.